Dental. Our little doggy patient here. I'll give you a good look at her teeth. You can see she's got quite a bit of tartar buildup, especially on the molars. That's where we always tend to see it first. So on those back teeth. The front ones, not quite so bad. Those back, they're dirtier, and you can see her gums. They're a little bit red too, so this is a good time to be getting these cleaned up and try to prevent infection in her mouth or loosening of those teeth. We'll see when the tartar comes off if her teeth are still nice and strongly in place. You can see her, she's hooked up to gas anesthetic. And she's also on fluids because dentals take a little bit of time usually. It's good to have the fluids running to make sure that their blood pressure stays up and that they don't get dehydrated during the procedure. So we'll get started. So right now we're going to start by just using these dental tools to crack off some of the thicker tartar here. You can see how that just cracks right off. You can also see that how easily her gums are bleeding because they are irritated by all that tartar, and very little touching will make them bleed. The tools we use are very, very similar to a human dentist. The next tool we use is an ultrasonic scaler. It uses ultrasonic waves to blast the tartar off the teeth. Sprays water at the same time so the teeth don't get overheated. You can see how that's taking that tartar off. We move back and forth over the teeth because you don't want to leave the ultrasonic scaler on any one tooth for too long, because it can damage the root if you leave it on for a long time. This is the dental machine, all the different tools as we showed, the ultrasonic scaler and the polisher. It's also a drill and a little squirter. These inside surfaces as well. And we just hold the tongue out of the way to do that. Insides look pretty good. This side was very similar to the other side in that most of the tartar was concentrated over these back molars. Just build up off the teeth. Along the gum line is important because that's where you're going to get bacteria entering the body. Polishing. Got all the tartar off, and we're gonna just make the surface nice and smooth and shiny, and send this dog home with lovely smelling breath and a yummy tasting mouth. Now we're just gonna clean that off. See how great her teeth look now. Pearly white and very healthy. And this was the perfect time for this dog to have her teeth done because you can see none of them are loose. They're nice and healthy underneath that tartar. So this was the ideal time to come and get that off before any permanent damage is done. So we're going to anesthetize this kitty for his dental. He has already had what we call premix or sedation to kind of take the edge off a little bit. need quite as much of this usually. So then they get an injectable anesthetic that goes in their bloodstream. So that's what we're doing now. Now, cats get a little squirt of stuff to numb their larynx. They can have a reflex that will cause it to want to spasm, so that helps prevent that problem. Oh, and we need a little more. Still want to swallow. So another little squirt here. So, let's tube in for his gas anesthetic, tie it in place. It's ready to get hooked up to the gas. Now this patient is around 9 years old. His teeth are a little worse off than the dog patient we just saw. You can see his gums are quite red. Again, those back molars are the worst. His canine teeth are pretty yucky too. Bottom teeth aren't quite so bad. But we'll get those shined up. So the procedure with cats is the same as in dogs. Cats have fewer teeth than dogs though, so this may take a little less time. We're editing, of course, so you're only seeing a few minutes of what actually takes usually at least a half an hour to really get teeth clean, and then sometimes longer if there's extractions that need to be done of loose teeth or diseased teeth. A lot of these bits won't come off. They're staining deep in the grooves of the teeth. So we'll do our best to clean that up. Quite a heavy buildup of tartar here. You can't even really see the teeth beneath. You can see that big chunk of tartar that comes off. Sometimes people don't realize just how much tartar there is on the teeth. It can get very thick, and again, bleeding quite easily because his gums are very irritated by all that. They'll look great when we're done here. Yeah, the aftershock.
Where's the better? Oh my gosh, there. Ooh, nice.